This is the lecture on the appendicular skeleton. All right. So this lecture is based on Human Anatomy Martini's chapter 5.3 and 7. Here's your list of learning objectives. Here are your drawing assignments: the scapula, the shoulder joint, the pelvis, and the hip bone, and now the appendicular skeleton. So the appendicular skeleton includes 126 bones. The pectoral girdle has two scapula and two clavicles, and it connects the upper limbs to the axial skeleton. The pelvic girdle, the two hip bones, connects the lower limbs to the axial skeleton. And altogether, of the 126 bones, 106 are in the wrists, the hands, the ankles, and the feet. All right. So the other bones, the other 20 bones, are fewer and not so hard to remember, right? Since they're in, there's two of each, right? So it's not as bad as you might think when you start off hearing about it. All right. So here's a rundown: the appendicular skeleton. So the pectoral girdle, two clavicles, right and left, two scapulas, right and left, right? The upper limb bones, 60 of them, but most are in the wrist and the hands. The humerus on both sides, the radius, the ulna, and we're done, except for the wrists and the hands. There we have our carpals, the wrist bones, the metacarpals, the hand bones, the phalanges, the finger bones. All right, we're done with the pectoral girdle and the upper limb. Moving on to the pelvic girdle. That is two bones, the hip bones, right and left. Then the lower limb bones, 60 of them, most in the ankles and feet. So we have two femurs, two little patella, knee bones, two tibia, two fibulas, and then we get down into the ankle, the foot, and the toe bones, okay? And that's it. So, yeah. And we will learn the carpals, metacarpals, and phalanges, the tarsals, metatarsals, and phalanges in groups, right? So, much easier than it might sound like at first, knowing that there's 126 bones. Okay, so the pectoral girdle and upper limbs. Let's do the pectoral girdle first. And I would like to say before I start that throughout this lecture on the appendicular skeleton, we'll be talking about bones. And when we talk about bones, we talk about bone markings quite often. And what is the point of talking about bone markings? Well, bone markings can be points of attachment for muscles and or ligaments. They can be places that a blood vessel or a nerve goes through a bone, all right? So that's why we talk about bone markings, because they're there to do something, right? They're not usually just there to decorate the bone. So that said, let's begin talking about the pectoral girdle. So the pectoral girdle partly wraps around the superior rib cage. Starts at the joint between the sternum and the clavicle. Then we have a joint between the clavicle and the scapula. And then in the back, the scapula stops, a certain distance away from the vertebral column. So there's, a gap in the pectoral girdle in the back. The pectoral girdle does not completely wrap around the superior rib cage, just partly. Okay, and of course, the clavicle and the scapula attach the upper limbs to the axial skeleton. All right, the clavicle. The clavicle is a long bone. It has a wavy shape. You see here the right clavicle superior view. Medially, it would be attached to the sternum. Then it sort of curves forward away from the rib cage, and then it comes back against the body, and then the flared end attaches to the acromion of the scapula. But all in all, it has a sort of a wavy shape. So the joint between the clavicle and the sternum is the only direct connection between the pectoral girdle and the axial skeleton. So it's a strong joint. It doesn't have a whole lot of movement. And that is how the pectoral girdle is attached to the axial skeleton. All right, moving on to the scapula. So the scapula is a flat bone with a complex shape. It is a triangle, like a, upside down triangle. It has a superior medial and lateral border. Then the posterior of the scapula, which is this picture on the lower right, it has a spine that extends laterally, and at the far lateral superior tip flares into a part that is called the acromion, which is the name of a hill in Greece. So the spine and the acromion are continuous. The acromion is an important feature of the spine, let's say, but it's called its own thing, the acromion, right? And both the spine and the acromion are easily palpable on people. If you feel another person's scapula, or if you feel your own, you should be able to palpate the spine and the acromion. Now, notice if you look at the lateral view in the center, this is the right scapula, this is the lateral view. We see that the acromion is posterior, as well as being lateral and superior, it's posterior. If we take a line through the flat plane of the scapula, we definitely see that the acromion is posterior. And as I said, the clavicle and the acromion articulate with each other. The name of the joint where they articulate is called the acromioclavicular joint. Acromio for acromion, clavicular for clavicle. So it's not just a mystery word, it's got the two parts of the joint in it, right? And then what are two functions of the acromion? It is an attachment point for the middle of the trapezius muscle. Here's the trapezius muscle in the right picture. And it's also an attachment point for the deltoid muscle. All right, now moving to the anterior of the scapula. The anterior of the scapula has the coracoid process. So if you look at this right lateral picture, you see jutting out anteriorly the coracoid process. And this is also on the lateral superior tip of the scapula. But whereas the acromion was posterior to the plane of the flat bone of the scapula, this is definitely anterior. And the function of the coracoid process is it's an attachment site for the short head of the bicep brachii muscle and an attachment site for the pectoralis minor muscle and the coracobrachialis muscle. And I know we haven't learned any of the muscles yet, and you don't have to, for this unit, know the muscles. But I want to introduce to you why there are these bone markings. It's because they're attachment sites for muscles that we will learn. But I did add a picture of the muscles so that you would have some idea and not just have it be words of what it actually looks like. And so here is the short head of the bicep brachii muscle. If you're listening to this, you can't see what I'm doing, but I'm using my little arrowhead to point. And then in the green is the coracobrachialis muscle. And then actually not labeled here in black and white is the pectoralis minor muscle. Right, so I'm pointing those out. I'll add a little label if I remember in the slides. So because the scapula is not actually attached directly to the axial skeleton, it has many muscles that help to support and position it. And we will learn these muscles. They include the trapezius. I'll point to them with my arrowhead. The trapezius, the rhomboids, the levator scapulae, the serratus anterior, and the pectoralis minor. All help to support and position the scapulae. Now, the scapula is mobile. It can move out. It certainly can move more than the clavicle, although because it's attached to the clavicle, they do move together a bit. So what can the scapula do? How can it move? It's able to glide around on the back. And now I'm going to use some words for movements that haven't been introduced before, but that will become familiar when we learn muscles. So the scapula is able to be moved in retraction. And here's a picture showing retraction in the bottom panel, right? And that means, pulling your shoulder blades together, pulling the scapula together, like in military posture. Okay, the scapula can be moved in protraction. And this is, think of hugging a person or a tree, and your arms wrap around the person and your scapula glide forward on the posterior rib cage. The scapula can be lifted in elevation. They can be moved downward in depression. they can be moved upward and rotated at the same time, as in lifting your arms over your head to put a piece of luggage in an overhead compartment in an airplane. The clavicle joint limits the range of these movements. All right. But here, this is a nice picture showing you, does the clavicle move at all? Well, yes, it does. Okay. So here they're showing you protraction and retraction and showing the relative positions of the clavicle and scapula in the two movements. And you can see that the scapula has moved and so has the clavicle. And then they're showing you elevation and depression on the right side. And they're showing you that both the clavicle and the scapula have moved. So that's all interesting, all of you, future physical therapists. All right, the shoulder joint. It's a very important joint. The lateral border of the scapula contains the glenoid cavity, which is a shallow cup. It's barely even a cup at all, okay, that articulates with the humerus. And together, the scapula and the humerus form the glenohumeral joint, or the shoulder joint. Now, gleno stands for the glenoid cavity, and humeral stands for humerus. So again, the name is related. Now, it would be easier to remember if they had called it the scapulohumeral joint, but they didn't. So now you have to remember an extra thing. This area is called the glenoid cavity, and the joint is called the glenohumeral joint. Do I expect you to know a word like that? Yes. Yes, of course. This is a major joint in the body. The shoulder joint is the most mobile joint in the body. Super important to us humans because we do so many things with our hands and our arms, and all of it needs the cooperation of our shoulder joints. The supraglenoid tubercle is a bone marking superior to the glenoid cavity. It's the attachment site of the long head of the bicep brachii muscle. The infraglenoid tubercle, inferior to the glenoid cavity, is the attachment site of the long head of the tricep brachii muscle. So now we've found out where the two heads of the bicep brachii muscle are attached to. There is a short head attached to the coracoid process, and there is a long head attached to the supraglenoid tubercle for the bicep brachii muscle. For the tricep brachii muscle, we've only learned of the attachment of one of the three heads. Tricep means three heads, and that's that the long head is attached at the infraglenoid tubercle. In the muscle lecture, when you learn about the tricep brachii muscle, you will learn where all three of the heads are. But this is what we're just learning. The first head is inferior to the glenoid cavity. Many movements can occur at the glenohumeral joint. All right. So now we're not talking about the scapula moving on the axial skeleton. Now we've moved over, and now we're talking about the glenohumeral joint, the shoulder joint. What kind of movements can be performed at the shoulder joint? Well, here's a bunch of new words, or maybe you're familiar with them. Okay. So the glenohumeral joint can abduct. Abduct means take the limb away from the midline. Okay, like abducting a person, taking them away. So abducting the limb from the midline. And you see down here the picture of this guy. He's having his arm being taken away from the midline. This would be like you were pretending you could fly like a chicken when you were a kid or whatever, abducting, right? Abducting is bringing that arm back. And you can look at the pictures. Then there is extension of the glenohumeral joint, and that means taking the arm, which would ordinarily be hanging at our sides, and moving it towards the posterior, okay? Extending it posteriorly. And then there's flexion of the glenohumeral joint, which would be moving the arm anteriorly. And hopefully these pictures will help. And then there is medial and lateral rotation at the glenohumeral joint. Medial rotation rolls the humerus towards the midline, and lateral rotation rolls the humerus away from the midline. Okay, so onto the humerus.